Greetings from Suraj Institute, Nagpur. Association of retinal nerve fiber layer thickness and systemic hypertension. Autoregulation is an important blood flow regulatory mechanism existing in retina and optic nerve head. It helps to keep the blood flow relatively constant during changes in perfusion pressure. The perfusion pressure depends upon blood pressure. Several studies have reported that changes in systemic blood pressure can affect ocular blood flow, which is associated with progression of glaucoma. It has been reported that hypertensive patients with no retinal abnormalities or glaucomatous change show inner retinal layer thinning, including the ganglion cell inner plexiform layer and peripapillary retinal nerve fiber layer. It is speculated that chronic ischemia caused by retinal microvascular disorder might cause changes in retinal structure. A male, 42 years of age, came with complaint of blurred vision in left eye and diplopia since past 3 days. There was no history of similar complaint in the past. Patient was not a known diabetic or hypertensive and was not on any systemic medications. Upon examination, his visual acuity was 6.6 and N6 in both eyes. Anterior segment examination was normal with an intraocular pressure of 13 mm mercury in both eyes. Posterior segment examination showed sclerosed vessel with a cotton wool spot in right eye. Left eye showed inferotemporal RNFL wedge defect. Spectral domain optical coherence tomography of the right eye showed reduced RNFL thickness in the superotemporal quadrant. SDOCT of the left eye showed reduced RNFL thickness in the inferotemporal quadrant. OCT findings were correlating to the clinical findings. His random blood sugar was 142 mg per deciliter and blood pressure was 204 by 134 mm of mercury. Right eye color fundus photograph showed sclerosed vessel with cotton wool spot. OCT in the right eye showed reduced RNFL thickness in the superotemporal sector. Left eye color fundus photograph showed superotemporal and inferotemporal RNFL wedge defect. OCT of the left eye showed reduced RNFL thickness in the inferotemporal sector. In our case, with the evidence of retino-microvascular changes and RNFL loss, we were able to subject the patient for systemic evaluation, which led to the diagnosis of glaucoma. Hypertension has range of effects on the eye. Hypertensive retinopathy refers to retino-microvascular changes that develops in response to raised blood pressure. Hypertension is also a major risk factor for the development of other retinal vascular diseases including retinal vein and artery occlusion and ischemic optic neuropathy. It has also been implicated in the pathogenesis of glaucoma and age-related macular degeneration. RNFL analysis on SDOCT provides an objective assessment of the optic nerve and neuroretinal rim as well as quantitative estimation of retinal ganglion cell axon loss that happens in glaucoma. Numerous studies have reported that retinal macrovascular abnormalities lead to glaucoma and are related to both the presence and severity of hypertension. The strength of association between retino-macrovascular abnormalities and hypertension has been observed to vary with age and race. The association appears to be stronger in younger compared to older persons. We demonstrated the effect of hypertension or RNFL with this case. Thank you.